Thank you. Okay, over
Good
to you,
morning.
Doctor. Yes.
Yes, good morning, everyone.
Morning.
I hope, can you hear me?
Yes, yes, we can hear you.
Very good.
Yes.
Thank you so much for the invitation to share with you our reflection on mental health care. And thank you, Sister Tao. Thank you, Father Sipalele, and thank you all the team of LCCL. Thank you really for coming up with this initiative, with this team, which is mental health, which is very important in our life, because when God created us, he didn't only give us a body, but he gave us body, mind, and soul. So we are psychosomatic beings, as the medical anthropologists would say. Well, as Sister Tau has introduced me, my name is Melese Shula. I'm the Skills Development Coordinator for the Catholic Healthcare Association of Southern Africa. As you all know, CATCA is the voice of the Catholic Church on health in South Africa, of course, in Botswana and Eswatini, and then it's, of course, is the umbrella body for all the health community-based health care organizations in these three countries. And well, there are about 250 member organizations that are forming what we call the Catholic Healthcare Association. And of course, as you all know, our head office is based in Rosebank, even though our members are scattered across practically the 9 provinces in South Africa and in Botswana and Swaziland. So just as I share this reflection with you, actually I've got 2 presentations. Before I go to the first presentation, I want us just to listen to a short video clip, which was sent to me by the president of the Association of the Catholic Mental Health Ministers from the Diocese of Scranton, who is Deacon Eddie Schooner. I just want us to, just for about 2 minutes, if you let me know if you can hear. Ne?
No.
No, Melissa, I think you have to, there's a little icon says share sound. You have to share sound.
Okay. More fun. More fun.
Maybe stop share, and then before you put on the screen, before you share, there's a little icon on the left side. You click into it and then share.
On a left icon. Yes.
You
No.
see, when you put share screen, and then there's a little box says share sound on the bottom of the screen.
As it stop security share screen. No,
yeah.
No. Is it advanced sharing options? Is it not?
No, go to basic area. It's fine.
Basic sharing, no, sister.
Yeah. And you see on the bottom they say share sound.
Share sound. Stop sound. No.
Bottom.
Not sister.
The same line when you click to share, the same line. There's on the bottom. There's the left corner says share sound.
No, I couldn't find.
Oh, you see optimize for video clip?
Okay. Optimize video clip. Choose video. No. 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 Advanced sharing options. Let me just see. No. All participants. No system. Yeah.
If you share basic is fine. You don't have to go to advanced, but not on top of the screen, but at the bottom of the screen. The same line when you like the blue button called share, then you see you see the like two boxes. One is say a share sound and one is optimize a video clip.
No, sister. No.
Okay.
No, let's save our time. I think it's fine. I can stop. Yeah. No. No. No problem. Let's just skip this. No, all right. So I just want to it's okay. I just let me check. Okay, let's go to this one. All right. So I think we just I will share later on, perhaps if the technology allows me. Once again, thank you for this opportunity. And then I just want us perhaps, to have a sort of open discussion before I go to the details on these following questions that I'm sharing here on the screen, if you can see. Why do we need to discuss mental health care in consecrated life? What is mental health care itself? What comes to our mind when we hear about the mental health? And why is mental health care so important in our life today? Well, perhaps for you as a members of the religious orders. And what happens if there is no sufficient care about our mental health? And how should we care about our mental health and of others? Could we perhaps have just a few minutes for discussion on response also? Are we there?
Yes.
Yes. Can I hear from you, from anyone who would like to respond to some of these just very simple and basic questions? Yes.
For me, when I think of mental health, I think of our mental well-being.
Yes, thank you so much, sister. So you say when you hear about mental health, what comes to your mind is a way mental well-being. Yes, thank you. What do others say? This, I was told, is going to be a sort of workshop, not a lecture. So I want us to really to participate. Yes. Okay, it could also be, yes, our mental well-being, yes, but why do we need to discuss about our mental well-being? It's okay because we do pray, every day, we are fine. So why do we need to discuss about our mental well-being? Why is it so important in our era of today?
All right, so I've just raised the hand.
Yes.
Just to share my views is that, like, with mental health, it's important to discuss it because it's not always possible to have the conversations, like, in community settings, whether during prayer time or during community recreation or what, discussing mental health is not always.
The men went there. The male went.
Somebody's talking. I don't know if you can hear me.
I hear you, but yeah, there was a background.
Okay,
Yes.
sorry. Yeah, so I think it's important because, like, mental well-being is just as important as our physical well-being. If we're not okay mentally, we can also be experiencing pain. And if we're not aware of it, we can either cause harm to ourselves and even cause harm to other people. So that's why it's actually very important to talk about it, to explore these areas, because we could actually end up harming ourselves or others if we're not aware of certain.
Thank you so much, sister. Yes, you said mental health is not a topic which is always, on top of our head. We actually prefer to shy away from discussing. So you said by not discussing, by not bringing to the surface, we may actually create even a damage or harm others. And you said it's of course also our mental health is also linked to our physical health. Thank you so much, sister.
For me, I think we need to discuss mental health because we are encountering it even more now in these days since and in this era. So it is our everyday encounter. And sometimes we need to know how best to handle it when we meet with it. And also, like, if we experience such a thing, how to deal it in the best
Thank you so
way
much,
we
sister.
can, and to be aware of.
Great. Thank you so much, Sister Nancy. You said mental health issues are the issues that we come across on a daily basis. And that is something that is affecting us, also affecting people around us. So we need to discuss in order to deepen our understanding. Is that what you say? Thank you, sister. What do others say?
I saw the hand, Sister.
Yes. Yes, sister. Yes.
Someone raise their hand. Okay. Greater, who is greater? Please. Yeah.
Yes, for me, I think mental health is a state of mental well-being that enable people to cope with the stress of life, realizing their ability. So we must discuss it so that we can be able to contribute in our communities.
Thank you, sister. The aim is we need to discuss the mental health issue in order to contribute to the well-being of our members in the community. Thank you so much,
Yes.
sister. Yes. What do we have any other hands, perhaps?
There was one hand, but I saw it's down now. Sister, I think.
Oh, it's Sister Martha. What I wanted to say was said already. So I lowered my hand.
Okay. Is it? Thank you,
Yes.
sister. All right.
Thank you.
We take it. Yes, we take it as if you have said it already then.
Yes.
Now,
so
sister,
it was going to be a repetition.
Yeah, okay. Why? What happens if there is no, I mean, sufficient care for about our mental health, and if those sisters and brothers around us, why do we need? What happens? Or what do we see happening around? I know, Sister Nancy, you said, no, it's a challenge that we face on a daily basis. But then what happens if we don't offer or render sufficient care for ours and for the mental health of others? I don't know if I have any hand to send. No, no.
Sorry.
No. Yes, Sister Stephanie.
Well, for me, mental health or mental well-being is not something that is, my experience of it is that people don't like to talk about mental health. They're quite happy to talk about their physical health because you can see it. You can see when a person's not well. But when you're talking about mental health, you could be talking about depression, you could be talking about bipolar, you could be talking about schizophrenia, you could be talking about, and these things I think are scary topics. So when those topics are, and addiction is, I do believe, also a mental health issue. So those are difficult issues to talk about. It's much easier to talk about if I've got a cancer, or I've got a pain in my stomach, or I've got a headache, or whatever. So to be able to be brave enough to have those discussions about these hidden things, and the problem about the supposed hidden things is that actually they're not hidden. They actually project onto the community, and they become sores in the community, I believe. And people don't talk about them and can't talk about them, or don't want to talk about them. So they become things that mess up community relationships, but they also damage the person who is hiding them.
Thank you so much, Sister Stephanie. You said because of the stigma and the social discrimination, we normally don't talk about the mental health issues.
Mm.
So thank you so much, sister. That is what I have just heard from you. Thank you so much. That is so true. And we don't talk about mental health due to the stigma, which is associated to mental illness, and of course the discrimination as well. Thank you. Perhaps any other? Yes, Sister Bulungi. See? Yes, sister.
The question, what will happen if there is no sufficient care about our mental health, is that like sometimes it will lead to depression because our minds, they're not separated from our bodies. So from that, it will lead to depression and mental health issues like depression, headaches, and all. Like sometimes we get fatigued because there's no sufficient care of our mental health.
Thank you so much, sister. You are saying lack of speaking about the mental health leads us to depression.
Mm-hmm.
Not simply to a depression. In your word, it would even lead us to severe depression, where we would end up practically getting away with our life. Thank you so much. Okay, let's just go continue. And very good. Perhaps it's always just good to look at the what you call our back, where we are, to know just where we are, where our country is when it comes to mental health. So what is happening? I just want to reduce them. As you know, in South Africa, the South African government's mental health policy provides the legal framework to uphold the right to mental health care for those in need, as we all need mental health care, whether you are a doctor or a religious, you belong to a religious order or a lay person, we all need mental health care due to the current situations in our life. The South African government's mental health policy does provide the legal framework to uphold the right to mental health care for those who need it. However, its effective implementation remains as a major challenge, especially in underprivileged areas. Since 2021, I've been involved in parish mental health care in some of our dioceses at the Episcopal Conference. My work when it comes to implementing the parish mental health ministry has been more in the rural communities, in the rural parishes. Currently, this year, we are helping in some parishes in the Diocese of Klerksdorp. And then yesterday, I was in yesterday and the day before yesterday, I was in Bethlehem, because they also we need to implement the ministry, and then in the Diocese of Witbank, again, where I have already discussed with the bishops, where you could see that after my discussion with the clergy and with the lay, or let's say with the parish pastoral council members, I could still see that the effective implementation of this, the wonderful and so great policy, still remains a major challenge, more especially in underdeveloped or underprivileged areas. Not only that, While specialized psychiatric care is by and large available at the, let's say, at the national referral hospitals, there are still limited mental health services provided by lower levels of care, such as local clinics and even community-driven projects, which has a negative impact on our country's mental health well-being and social inclusion. And not only that, there is a high prevalence of the mental health conditions in our communities. I'm quite sure you might have watched on the news or, well, on the radio or on TV. Was it like 2 weeks back? I'm making an example of a lady in Butterworth, in the Eastern Cape province, who killed her 3 daughters before she herself died by suicide. I'm quite sure you might have heard. There was also an incident in Durban, I think it was somewhere in KwaMashu, where a man practically burnt his entire house and then eventually also died later on. These are the effects of mental health issues, unfortunately. We may say, well, it's because of the poverty, but it, at the end of the day, leads to that challenge where I think one of the sisters said, no, you know what, not discussing about the mental health issue, not discussing about the challenges that we all face due to our mental health challenges, it can lead us to what we call to depression. And then, when one starts actually having severe mental, what we call depression, the end is just practically getting away with his or her life. And I'm just mentioning those 2 practical examples just for us to, to understand what is happening and what happens when there is no proper care about our mental health. On the other side, there is a lack of knowledge, as you said already, responding to some of the questions that I posed. There is a lack of knowledge, and there is a social stigma. There is still discrimination and a belief that people with mental health conditions are either bewitched, or they are possessed, or sinners. And then I thought we need to just bring these issues and discuss. And the experience of depression, anxiety, chronic stress, and substance abuse are all common to the emotional life of many people in most of our communities. That's what we see. There are also severe mental illnesses such as schizophrenia, bipolar disorder, psychotic episode, and so on and so forth, which also impinge on the life of our people and also their families and then our own families. So we need to discuss then mental health issues. On the other hand, mental health care or mental health in general, it is poorly understood even by clergy. As one of the sisters said, no, we don't understand well, so we need to deepen our understanding so that we are well prepared to deal with the challenges that of other people or even of our own, so that we can save life. That's what the aim of our, I think, the call to the religious life is. Because unfortunately, there is still poor, there is a very poor, and it is poorly understood even by clergy and others in a position of influence. I remember when I went to see His Grace Archbishop Butit Lahale in 2021 to discuss, the implementation of the mental health ministry in the Archdiocese of Johannesburg. He said to me, "Thank you and welcome, because mental health has been neglected in my pastoral duty as the Bishop of the Archdiocese of Johannesburg." Exactly, Bishop Victor Palana last year in November, when I went to see him to discuss the implementation of the mental health ministry in the Diocese of Blackstone, he said, "Oh, This is what I needed. I need it for myself. I need it for my family. I need it for the parishioners. And I need for my clergy in the diocese because we don't know what is happening. I don't understand it. Yeah? It's just to say if mental health is poorly understood even by our clergy. The same, actually, Bishop Thaddeus Kumalo of Wheatbank, when I went to see him a couple of weeks ago, he said, you know what, I need this mental health ministry for myself because I want to understand myself better in order to help others who face with mental health challenges. So, so mental health experts have warned not only just the clergy or the others in positions of influence. Mental health experts or researchers have warned that the silence about the mental health issue is too serious to ignore because it's something that we experience in our everyday life, and it is affecting all of us, and it is affecting also our society, our communities. At the end of the day, I firmly believe, because since you are the members of the religious order, your call is to serve others, and we need to, as one of you said, we need to deepen our understanding. We need to deepen our understanding of these challenges so that we can help others to come out of this situation. So there is a range of mental health problems that can affect us, and many of these are more common than, of course, that we may think, and then others could be more what we call minor. I was reading actually a paper written by one of the seminarians, I think from the Diocese of Scranton in the USA, where he conducted his study actually looking at how the clergy understand and deal with mental health issues. And the data that this student collected shows that 18% of the clergy, I'm referring to the priests, the deacons, and then of course the bishops, that 18% say they experience anxiety disorder nearly every day. And then some, of course, every year. Now, 7.2% of Catholic priests surveyed had severe level of mental health, or let's say anxiety and depression. And 92% of them, they said they had a low, or let's say moderate level of anxiety and depression. And here we can bring the issue of substance abuse and so on and so forth. No? So we, even in our South African context, we have already witnessed the effect of poor mental health, or let me just put it in a very direct way, which was with depression. Was it last year in the Diocese of Klexo, for example, we lost a priest. We lost a priest who died practically by what? By suicide. If I'm not mistaken, also in the Diocese of Marian Hill, there was a priest who died by suicide. And then in that document that was written by a seminarian, there were about 7 priests who died only just in America last year, who committed suicide due to mental health issues. So let's just put it, depression. I just want to bring again the same question before we go for another presentation. Why do you think now that it is important to care for our mental health? Why do you think now that we care for our mental health? If I'm not mistaken, when a young man or woman wants to join a religious congregation or order, the procedures he or she should go through is a psychological assessment. If I'm not mistaken, I know I was with the components, I did even to theology. In some congregations, this is a mandatory, while in others it is not. The purpose of this assessment is for integral growth of the candidate once admitted, isn't it? That's my understanding. Because there may be a greater emphasis placed on health because of the sometimes physically or emotionally challenging ministries in which the community may be involved. So because of these issues that we come across today, I think it's highly important that we discuss about our own mental health issues and the mental health care in general. So after just this brief presentation, before I share with you the message from Pope Francis, why do you now think that it is important that we care for our mental health? This is a workshop, it's not a lecture, so I want to hear again from you. Yes? Are we there?
Yes, yes.
Yes.
If you'd like to share, can just kindly unmute yourself and then share. Okay.
To me, I feel we need to care for our mental health. One, because we can then reduce the expenses in the future, especially because if we don't care for our mental health, then we get into like chronic diseases. We bring into ourselves like diabetes. We bring to ourselves like high blood pressure, which increases the expense in our congregations and as individuals. So I feel if we need to care for our mental health so that we can reduce the expenses in future. And again, if we are not sound of mind and sound of body, then we cannot manage to help another person. So we have to be helped first so as to help the other person. I feel it is important to start with ourselves, then to go to the other person, the other people in the society. Thank you.
So much. Yes.
Thank you, sister.
Just to add on that one, I think we need to speak about, I am Nonki. We need to speak about it because some of us are in it, some of us have passed through it, and some of us have seen our friends with mental problems. So it is high time that we accept the challenges that are coming with it and remove the stigma that we have. Because it's a shock to hear certain things that we like, yo, okay, this is me. Is it really me when we are doing these assessments that we are asked to do? So it will really help us to understand ourselves and to be able to understand others who are suffering from it. Thank you.
Thank you so much, sister.
Go ahead, Lucy.
Thank you very much. I also wanted to add on the point Sister Nancy said. It's very important actually to care for our mental health because it's a vital part of our life, and it impacts our thoughts, behavior, and emotions. And as Sister said also, we have to start with ourselves because being mentally like healthy mentally, it promotes productivity, like effectiveness in activities like work, caregiving, and also caring for those ones who have problems of mental health. So it's very important to care for our own mental health. Thank you.
Thank you.
And also, I think it's another way of assessing ourselves to know where I am with my health and to take action before it becomes worse.
Thank you so much, sister. Yes, Sister Greta.
I think it is important to take care about our mental health because our mental health also contribute to our decision making. problem solving, how we deal with stress, and how we can relate to others in our daily lives. That's why we have to always care about our own mental health. Thank you.
Thank you so much, sister.
Thank you. I would like to add something on what my sisters have already said. It is also important, I think it is also important to care for our mental health so that we can be aware of who we are and accept our whole being. Because sometimes you might find that when somebody has the mental health problems, he or she is unable to accept that this is the reality. Talking about mental health can also help us to accept who we are and the situation we are in. Thank you.
Thank you so much, sister.
And also, I think it's important to take care for our mental health so that I won't be a burden to other people around me, you know. Thank you.
Thank you so much. All right, thank you, sisters, for sharing. I just want us to move to the second presentation. There also we will definitely have our our sharing, because I want us to all to participate. I don't want to do a lecture. I do lectures whenever I go to Portugal, because once a month I deal with the students, but this is not what you call a lecture that we do. So it's more about sharing. All right, we had a brief sharing on what we call on our understanding and why we need mental health care. And I just want us to discuss very general understanding about what mental health is, because as we said, as I mentioned also in my previous presentation, mental health remains poorly understood even by those who are in the position of leadership, also by the clergy, and well, all of us, we understand very little about the mental health. So we just need to a little bit go further in order to deepen our understanding of the mental health in general. The World Health Organization defines mental health as a state of well-being in which every individual realizes his or her own abilities. That means if you are mentally okay, then you know your abilities, what you can, you know somehow you what you can do. You are able to figure out what you can do. And you can cope with the normal stress of life. As we said, in life, there are challenges that affect our mental health. There are certain things that would even distract us from moving forward. Yet, if one is okay mentally, they say can cope with the normal stress of life that he or she come across. Where there is a good mental state or mental well-being, one can work productively. That means you can work effectively, you can be effective, you can deal effectively and efficiently with your own daily tasks. And then you can make also a contribution to your community. That is what the World Health Organization defines mental health. Yeah? So what does that mean then? In this case, then a healthy person has a healthy mind and is able to think clearly. As someone said, our mental health also is linked to our physical health, by the way. So with good mental health, one can think very clearly, can make a realistic, what we call solve problems in life. He or she can work productively, and he or she can enjoy good relationship with others. You can also feel that's spiritually at ease. That means our relationship with God can be normal. because our mental health challenges can affect our relationship with other human beings and even with God himself. So we can feel spiritually at ease where there is a mental well-being, and can make a contribution, a positive contribution to our community, where if there is a good mental health. So it is this aspect of function that can be considered as mental health. So mental health is very important for us as individuals, for our families and communities, and it's more than just the absence of mental disorder. As we said, we are psychosomatic beings. You know, what makes us who we are is our body, mind, and soul, that holistic approach. So in this case, then, it is important that we care for our mental health, the mental health of our families and our community members, and then so that our relationship with God and with other fellow human beings becomes normal, and also we can make a positive contribution to our community and so on and so forth. Mental disorders or mental health conditions or mental health challenges can affect both men and women, can affect people from different age groups, including the young and the elderly. I was in Kuruman in the Northern Cape for the research purposes a couple of weeks ago, and I was discussing with the principal where he said in his surroundings, about 14 children who are in the high school died by suicide between 2022 and 2023. Just in one area. And that is why I just wrote there. Mental health challenges can affect all people of all walks of life. And it can affect men and women. And mental health, the mental disorders are common, so much that about 1 in 5 adults, they said, experience a mental health disorder at some stage in his or her life. That can be whether we are in church or outside, whether we are in the family or outside, or wherever we are.
Not easy, Joy.
Yes, sister? Yes, affects our mental health, what we call it affects us. So mental health disorders include a variety of different conditions, ranging from common problems, such as excessive fear and worry, or unusually sad mood, which we would normally call it depression, to more severe behavioral problems that can involve suspiciousness or violence, agitation, other unusual behaviors, which the psychiatrists would call it psychosis. There are factors definitely that affect our mental health. One, of course, they may not be a single, but there are many factors that affect our mental health challenges. Now, I just want to pose this question to you, since this is a workshop. From our own experiences, it could sometimes be, of course, from a family member or relative or someone with whom we have been in the religious house for years. What do you think are the factors that can affect our mental health? And why do you think these factors affect our mental health? And what are the mechanisms that we can use perhaps to work to eradicate or to improve those factors that affect our mental health? I'm throwing this question so that we can all share out from our understanding. Yes? What are the factors that affect our mental health?
To me, I think things that really affect or can lead to mental health problems, one of them is always being under someone who is oppressive or looking down on someone and is not allowing you to be yourself, to express your own self. So you are always anxious on what that person will say of what you're doing, and again being in abusive relationships. There is also like if someone is not giving what is expected of them to give, so someone feels anxious and as if they can't fulfill their own dream, and it brings, so they feel that they are not good enough. So these, I feel, there are some of the things that can lead to mental health problems. Thank you.
Thank you so much, sister. You mentioned about the oppressive attitudes where there is no room for one to be himself or herself. They could be, that could also be one of the factors that affect our mental health. Thank you so much, ma'am.
I think the other factors that causes that's affecting mental health is like experiencing discrimination and like living with the stigma, or like our history. When our history is not like, if some of the people, they were abused and it still carries on and it's not like explained or dealt nicely. So with that experience, it can cause it can affect their mental health. And the other one, like losing someone close to you and without the proper bereavement, can cause mental health issues. Thank you.
Thank you so much, sister. You mentioned the discrimination, our past history, and where there is abuse. That could also affect our mental health. Yeah, and then of course you did mention if you have ever lost someone who was dear to you, very close to you, and you didn't really have that time of bereavement, it could also affect our mental health. Thank you so much.
I saw Sister Talon's hands. Can you unmute? Okay, thank you.
Yes, as for me, I think things like trauma, when someone is living in a situation where he or she is being abused, those things might lead that person to mental disorders. And also what I think also severe or long-term stress. When someone keeps something for a long time, he or she might be disturbed mind-wise. And also things like social disadvantages like poverty. When you are very poor, you're in a situation where things are not enough for you, somehow you'll be mentally disturbed. Thank you.
Thank you so much, sister. You mentioned about the traumatic experiences that we may go through, at any time in our life. That can affect our own mental health. And then, of course, you mentioned also the low social status, so let's say the poverty can also affect our mental health. Exactly the example I shared about someone who killed her 3 kids and then who in the end also died by suicide was practically related to that. And thank you so much, and it makes perfect sense.
Sister Lucy?
Yes, just to thank you very much. Yeah, just to add on what the sisters have said, actually, another factors I would say is genetics and family history. Also, it can also be one of the factors that can affect our mental health and childhood experiences. Then another sister said the point that I wanted to say, this big societal issues like violence, discrimination, and poverty. Thank you.
Thank you so much, sister. Yes, the genetic factors, and then of course the violence that we unfortunately experience on a regular basis can also affect our mental health, can be the factors that contribute to our mental health issues. Yes, thank you.
Sister Katie, I saw your hand. Okay.
Yes, it's just a reminder, which Sister Nonki also reminded us to maybe just for those brief seconds that we're speaking, that we share our video. It's really quite nice to see who is listening to. And so please, if at all possible, do try to share your video. Thank you.
Those of you who have shared up to now, you practically have mentioned the factors that could contribute to our mental health challenges. I would like to hear also about the mechanisms that we could use in order to reduce those factors from affecting our mental health. That practically I'm referring to that question 3 on the screen. What can we do? What contributions can we make? What sort of mechanisms could we use from our own experiences and from our own context to reduce the factors that affect our mental health? And then, of course, the mental health of our brothers and sisters.
To me, I think one thing that helps me to sort my problems, or this is from a personal experience, is working with arts and crafts, and imagine myself in where I'm mostly talented in, and even doing some exercises. This helps me and helps many people that have dealt with who have these problems, and I have seen it work, and I feel, and also talking about it, sharing about it also helps me and helps other people. Thank you very much.
Thank you, sister. Yes, sharing about my challenges, those issues that affect my mental health, by speaking out, I get some sort of relief and then a help. Yes, thank you so much, sister. Yes, I think we have Sister Christina on. Yes, sister.
For me, I believe that when I'm sharing my problems or the struggles that I may have encountered with someone who will listen to me, it can help me. If I share with the person whom I know very well that she understands me, she will not judge, she can encourage me. I think I can share my problems or my struggles with that kind of person who understands me. Thank you.
Thank you so much, sister. Yes, by sharing with someone who can understand me, I can help get what you call a help. And that is one of the mechanisms that I could use. Thank you, sister. Yes, I see there are 2 hands raised. You can say any of the 2.
Sister Carolina, go ahead.
Thank you, sister. Pardon me, my computer has a problem with the video. That is why you're not able to see me.
Okay, no problem.
Okay. As for me, the mechanism that I think or that has worked for me through my experience, it is writing down, jotting down all my feelings and my emotions on a paper or in a book or in a journal can also be helpful. It can also help to reduce the strains in the mind. Apart from that, talking to experienced people can also help to better our mental health. Talking to experienced people like counselors or psychologists or people who are more aged or who have experience in life, because I believe that the challenges that we are facing now, they have already passed them and they know how they handled the situations. So that is how I think our mental health can be assisted. Thank you.
Thank you so much, Sister Caroline. You mentioned about one very important aspect, which is writing down. I know I've met also a couple of friends who say they write down something that happens in their life, the significant event that could even affect them positively or negatively their mental health. So that is very important mechanism. Yeah, thank you so much, sister.
I think to stay active as well, because I believe loneliness also can be one of the factors that affect our mental health. So I think to stay active and to share our feelings or to talk about our feelings. Thank you.
Thank you, sister. Okay, thank you so much. Yes.
I do think that learning, being informed about the various mental illnesses or the various mental disorders, some of which may be my own, for example, anxiety, that we can also then know what causes, if we can find the root cause of that, whatever it is that is disturbing us, or even try and help others to understand what is disturbing them. So I think that information, knowledge is very important.
Thank you so much, sister. Being informed about mental health and the root causes of those illnesses attached to mental health can help me and also to help others. Thank you so much, sister. I think we have someone also who wants to say something.
I saw Sister Martha's hand. Sister Martha?
No, we can go ahead. The points are said already.
Okay.
Okay, thank you so much, sisters, for sharing. Let's just.
Possible we have some break.
Or is it? Do we need a break, sister?
I'm not sure. How is everyone doing? Should we continue or should we have 5-10 minutes break?
Maybe a 5-minute break might be good.
Okay.
5 minutes
Yes,
break.
please.
If okay.
Yes,
All
please,
right.
please. Yeah, thank you.
Thank you.
Thank you. Thank you.
There's someone who's also. Okay.
Are we all back?
I think so.
Is
I think
it?
people, yes.
All right. There was a video clip that I wanted to share with you before we started with our presentation, but unfortunately, due to the technological, now thank you, Sister Tao, for directing me. I just want to share with you that for, hold on now. Huh? No. No, let's just continue and I will do that afterwards, no problem. So we were discussing about the factors that affect our mental health. And then of course, those of you shared gave very important hints to the questions. Thank you so much. And now let's just carry forward. They say there is rarely one single cause of a mental health disorder. Most of mental health disorders are caused by a combination of factors that you all mentioned. They said the first one could be a stressful life events. Someone did mention if there is a childhood trauma or even the neglect, or if there was abuse in the childhood, which has never been dealt with, can affect our mental health, even if we are already grown-ups. And this is indeed that we see, unfortunately, in many cases today. And
Sorry, Melissa, are you supposed to share the presentation?
I am sharing, yes, sister?
No, it's not here yet, no.
Oh, okay, all right. Let me just share again.
Okay.
Is that okay now? Okay, yeah. Thank you. Now. Yes. So stressful life events, the biological factors, and then as one of you also mentioned, individual psychological factors, for example, poor self-esteem or the negative thinking, or and then of course some unresolved issues that or challenges that occurred perhaps at the childhood can also affect our mental health. Poor self-esteem, for example, thinking always negatively that there wouldn't be any future, no improvement. That kind of thinking can affect our mental health. And the adverse life experiences during childhood, which I've already mentioned, like abuse, death of parents, or other traumatic experiences, can affect our mental health as we move along. So some people may be more vulnerable to mental disorder than others, but may not develop an illness until they are exposed to stressful life events. That means there could be issues, challenges, mental health issues, such as traumatic experiences that happen at the childhood. But the psychiatrists say that no, they become more worse when you are exposed to stressful life events, and then you start looking at backwards. So mental health disorders are not the result of possession by evil spirits. They are not by curses. They happen due to those factors that we mentioned in the previous slide. Of course, sometimes generally in African cultures, mental health disorders are associated to curse by ancestors or misfortune. And then these types of beliefs can delay early recognition of mental disorders and prevent appropriate treatment or even to follow up. And this, I think, is one of the areas that we need to put our focus and emphasize. Unfortunately, sometimes the cultural perceptions or practices can bring also negative impact or consequences to our mental health. Of course, biological factors can include genetics and brain injury and chemical imbalance in the brain. Sometimes people experiencing chronic medical problems such as heart, kidney, liver failure, and diabetes may develop mental health problems such as depression, as living with these illnesses can be very stressful. And then as we do our outreach or we'll visit those with the chronic illness, let's just also keep this in mind, that it's not only their diabetes or it's not only just their kidney aspect, it's not only that, but then along with that comes also the mental health issues, since these people are asking themselves, why me? So stressful life events can contribute to the development of mental disorders. As we said earlier on, the family issues. For example, the children who come from the family background where it's always a conflict. The poverty that we mentioned, or the unemployment, it can contribute to the mental health issues. And the death of a loved one, or of course the poverty, the same. And the violence and, well, in many cases, also living with HIV and AIDS, they say in our country can also can affect our mental health, because we are always thinking, what will happen? What would be my future? Because they would never stop thinking. So I did mention about the difficulties in a childhood where there is a physical violence, where there is an emotional neglect, not only just a physical, the emotional, if the children were exposed to that emotional, what you call violence, physical violence at home, and then also if there was an early death of a parent, can sometimes lead to a mental disorder later in life. And I think if we can, our task here would be to help where we can. Yeah? So the symptoms of mental disorders can produce a negative effect on the lives of individuals, families, and the society as a whole. We cannot always tell by looking at the person whether he or she has a mental disorder, because the symptoms of mental health disorders can be either physical or psychological. The physical symptoms of what you call mental disorders are those that involve the physical functioning of the body. For example, sometimes the pain that you may feel without even knowing where it is coming from, where you would feel also tired and exhausted, where you would have a problem with sleeping and an increase or decreased appetite, etc., are some of the physical symptoms of a mental disorder that we need to take care of. The psychological symptoms are those that could involve the mental functioning of the body. Some of the symptoms associated with mental disorders, such as feelings of sadness without even knowing why, and worrying a lot without understanding where this is coming from, can affect everybody from time to time. Now, these symptoms only become a mental disorder when they are excessive and prevent the person from living a normal life. And then we need to take care of ourselves then. So other symptoms such as hearing voice is nearly always a symptom of a mental disorder which would happen. Now, but of course, as we know, there are two types of mental health disorders. Normally, that's how the psychiatrists would put. These are common and severe mental health disorders. The common mental health disorders are the symptoms that practically that we all experience from time to time. For example, feelings of sadness, worry, or anxiety, and so on and so forth. These are just a common mental health disorders. However, these common mental health disorders, if they are not tackled in time, can also go to the severe mental health disorders. If you know there is a depression, remember there is 3 types of depression: moderate, no, the severe, what do you call? There is a mild, moderate, and the severe. A person practically, when he or she is in a because severe mental states, he is not aware of what is happening. So, but of course, this would start already with a mild. So we need to take care of ourselves where there is the signs of depression. Anyway, let's go to the severe mental health disorders. Severe mental health disorders are often difficult for general community to understand. For example, hearing voices or expressing strange or unusual beliefs. Then we may need the intervention of the psychiatrist to help us understand. So let's just go to the common mental health disorders. What happens? With the common mental health disorders, people with common mental health disorders usually experience physical, as you mentioned, remember I have just mentioned the previous slide, but the physical, emotional, and thinking and behavior symptoms, but not imagining symptoms. Now, some people may get treatment for physical problems associated with their illness, like poor sleep or appetite, but neglect the cause of these physical problems, such as underlying depression or anxiety, can lead us to the severe mental health cases. So people with common mental disorders are often not, if not treated, because it's more difficult for family members or health workers to recognize that they are suffering from a mental disorder. Sometimes we ignore or neglect because we think it is not important. However, these common mental health disorders, as the psychiatrists would say, if they are not treated at the early age, as I have repeated already 3 times, they can go to the what you call the severe mental health cases. Now, the main common mental health disorders are usually such as a sad mood that does not go away, which psychiatrists would call it depression, where there is excessive fear and worry. This is anxiety. And where there is excessive use of alcohol, substance abuse, this is what the psychiatrists would call substance abuse. So substance abuse, anxiety, and depression are the main common mental health disorders. So usually a sad mood that does not go away is a mental health disorder when the symptoms last for at least 2 weeks and they affect our ability to carry out our own daily work. And also, of course, having that positive relationship with our fellow brothers and sisters, including with God himself. So we need to be aware of this. Now, everyone can feel sad when bad things happen. occasionally, but that sadness is not simply a depression, though, if it has to go. So the symptoms of depression include usually sad mood and all or some of the following: loss of interest and enjoyment in activities that we used to enjoy in the past, tiredness and lack of energy, loss of self-confidence, feelings of hopelessness and helplessness, wishing if we were not there or if we were there, and difficulties in concentrating or focusing, and sleeping problems, and so on and so forth. Yes. Yes. Is there anyone who? Yeah. So experiencing a range of physical complaints that have no apparent medical cause, for example, weakness and ache and pains, these are some of the symptoms of mental health. But not every person who is depressed has all the symptoms. The severity of depression is different for different people, by the way. Now, events that contribute to the development of an unusually sad mood include normally distressing events that the person cannot do anything to control, like the death of a loved one, or the breakdown of relationship, or stressful life events. As we said, there is ongoing conflict and chronic medical conditions that we mentioned. And in some cases, women after birth, as we know, or normally go through depression. Now, let's go to the severe mental health disorders. People with severe mental disorders usually experience a mixture of physical, emotional, thinking, and behavioral symptoms, as well as imaginary symptoms. People with severe mental health disorders are more easily identified as having a mental health problem than those with common mental disorders. Remember, we said the common mental health disorders are those, the common, what you call, we all experience those from time to time, the common ones like depression, sadness, and anxiety, and so on and so forth. But they seem more obviously different from others in the way they think and behave. So this is with the common mental health, severe mental health disorders. Normally, psychiatrists divide the severe mental health disorders into three main categories. The first one being the psychotic episode, which is caused by a combination factors, including can be genetics, brain chemistry, stress, and other factors such as the use of drug, and intense depression can cause psychotic episode where a person practically is unaware of what is happening around him or her. The other one can be the schizophrenia, as we say, a disorder that affects a person's ability to think, feel, and behave clearly. So the exact cause of schizophrenia isn't yet known, but a combination of genetics, environmental, and alerted brain chemistry structure may play a role, according to the what you call psychiatrists. Now, schizophrenia is characterized by thoughts or experiences that seem out of touch with reality. As we know, disorganized speech or behavior and decreased participation in daily activities, difficulty with focusing or concentration, and memory may also be an issue, may be also there. So the third main category of severe mental health disorder is a psychotic, what you call bipolar disorder. So the person experiences extreme mood swings between low mood and high and normal mood. That's what happens, they say, with bipolar disorder. And the mood swings, sometimes elevated mood or angry without any reason, or as they would call it, euphoria, and loss of interest or loss of pleasure itself in activities that person who used to enjoy in the past. And the behavioral aspect of that is there is a lot of irritability, risk-taking behaviors, and disorganized behavior. And this normally category of what you call severe mental health care normally needs the attention of psychiatrists, by the way, not just the normal case. So if this is a case, mental illness is a real and as serious as physical illness. We cannot simply say to a person who is going through mental health challenges, pray about it and they will be all right. Because the truth is mental illness can't be understood or dealt with in terms of pious sounding in a Christian phrases or short or sweet quotes from the Bible or saints. I don't mean that prayer is not important. I don't mean that the scripture is not important. Actually, in the coming slides, I'll share with you some of the scriptures. However, we shouldn't forget that we are dealing with the person as a whole, with that psychosomatic being who has got a body, mind, and soul. We cannot simply say to a person who is going through mental health challenges, no, pull yourself together and you'll be all right. Or you pray and then it will go away. No. If you really want to help a mentally ill person, get to know him or her. And if necessary, just help him or her to seek professional help. Please, let's listen to them. Of course, if there is a need, we can pray with them. We can pray for them, but that's not enough. Let them know you will support them with your prayers. Let them know that you support them also with your presence. And then in case if it is beyond your ability to listen, to help that person, please refer to him or her to the professional help. I'm not sure if there is any intervention, anything that you would like to say before I proceed to the next slides. Is there anyone who would like to ask or just simply a comment or share any experience about the common and the severe mental health challenges that I've just mentioned?
Hello, Melissa.
Yes, I'm there for this plan.
Yeah, no, it's just a question from the work we've been doing with schools and institutions and churches and so on. I'm just worried or concerned about the preventative part, which I think we do not do much about. We tend to only try to deal with situations or cases. And in most cases, we are not equipped to respond to this. Has this been included in the curriculum in some way for early childhood development and also the school formation programs and so on? Because I think something that has been mentioned here, which is very true, is the question of stigma. Sometimes even when someone has a problem and realizes something is not going right, but to agree to go see a specialist or a professional is always difficult because someone is worried about what others will think. They will think I'm mad. They will think I'm dysfunctional or I'm not coping in my vocation and so on. So I think there's a need for awareness so that people can see it as a normal, if you say, a normal challenge. That could have been like a headache or migraine or whatever. But I'm just so, is there anything happening on those levels from your knowledge?
Thank you so much, Father Sipilele. That's very important, yeah. More especially, let me just go to the parish mental health ministry. Through our parish mental health ministry, we as CAPCA, what we are doing is practically raising awareness. about the importance of mental health. The mental health of our children and the adults and the young, actually. What our team members in their respective parishes where the ministry is being implemented, they are doing, this is practically what they do. Go out, listen to someone else, please, without a judgmental attitude. This is practically what is happening. Some of you might have listened to Radio Veritas, where I brought together, from time to time, the parish mental health ministry team members, just to share also with the public, with the listeners, what is happening. It's all about raising awareness. It's about raising awareness around the importance of mental health care, and then also, of course, working towards eradicating that stigma or social stigma and discrimination associated to mental health. Indeed, you are so right when you say there is still fear. It's so easy to say I've got a headache, but to say I'm depressed or I've got a bit of anxiety is something that we are not really used to discussing in public. But I've seen this. I've seen it, but of course it's a slow movement, yet there is. But when it comes to school, unfortunately, as you said, due to my research work at the University of Northwest, I do go to the schools, sometimes to the Catholic and non-Catholic schools. But the issue of the early childhood development of some in the curriculum, I haven't really seen it practically, but it has to be included because we need to bring to the attention of our children around the importance of mental health. That is why I always say this is from my own personal experience and judgment. Sometimes we have kids who struggle really to understand what the academic journey because of mental health issues. Of course, their own mental health, and then of course, as I was saying previously, sharing in one of the slides, some of the challenges that happen at home can affect their mental health, and then the end then affect their academic performance. Yeah, I hope I answered Father Sipelele to the questions you raised.
Thank you.
Thank you. I think somebody wanted to say, I saw the hand just.
Yes.
Yes, sister.
My question is, from all those factors that can affect someone, from experience, how can we help someone whom you can tell that this person is disturbed but not yet ready to share, or if you ask them, they will tell you, I don't trust anyone. That's why I just keep things to myself. But you see, someone is struggling with life. So my question is, from all those things, how can we help such an individual?
I think our first attitude should only be that of the Good Samaritan in the Bible. Next, sister. Remember the Good Samaritan, who is not even known. Nobody knows the name of that Good Samaritan. He is only known as a Good Samaritan. He met someone who was injured. We don't know the name of that person who was injured. We are only told that there was someone who was injured. He just simply bent his knees. We didn't ask him what happened to him. He took care of him. I think in our attitude also should only be simply to love them, to show them care, whether even if they are not ready to speak, that simple fact of being there with that caring attitude can make a difference. That would be my answer to that. Listen simply, even if he or she is not ready to speak, listen. You know that there are non-verbal, what you call communication that we can give attention to. Even if he or she is not saying something, he is already communicating something. So I think it's good to be there and listen to that person.
Okay, thank you.
You are welcome, sister. I see
Yeah.
Yes, I've got 3 hands. Yes.
I also think also helping them with that space to talk, creating that space to talk for them, and you listening to them, it might also be helpful. And of course, if it's difficult for them still, you can assure them that you are there when they are ready to share. I think creating that conducive environment for them to be able to share.
Thank you. Thank you so much, sister. Walk with them, be with them. For me, I always repeat that example of the Good Samaritan, because some of us may think, oh, the Good Samaritan did a wonderful job because he took care. No, 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 no. I think he listened. He was there from one end to another. We are not told in the gospel whether he said A, B, C, D or no. We are just said he worked with that person from one place to another. What did they discuss along the way? That was none of our business. So our presence can turn around a negative situation in the life of the other person, not only just our words. Thank you. I think there was another hand.
Thank you. I think it answered my question about how to communicate, but then you have answered. But sometimes I don't know if it is enough just to listen, and how to listen to somebody who's like, I don't know, are they shutting others out? Or firstly, like, yes, that part of shutting others out and how to reach out to the person, because it's not always that we are together. And to be honest, we as sisters, we hardly go and visit each other. We hardly go out and sit just to be around ourselves, except through meetings like this. So we are not able to meet each other through physically often. I don't know with others, but this is the experience that even when I was around, we hardly met. You see, so to know that you are listening or you are there for another, it's somehow another thing, because even you who's seeing the thing, you'll be like, am I doing the right thing? If I ask, will I be too much? If I keep quiet, does that show that I do not care? How to actually express our care is another thing that we are struck. But you mentioned that listening or being there or assuring the person, is it enough? I don't know.
It may not be enough, but somehow it can contribute positively to the the health of that person. That's my my point. All right, is Ayanda?
Mine is more of a question. Do you think that maybe someone in consecrated life who is afraid to talk about their mental illness, do you think that they might think that their mental illness or mental problem may be confused to their vocation? Thank you.
I don't know what the others say about this. I would really throw back that question to you and to the rest.
Sorry, I missed the question.
The question is, someone in consecrated life, do you think that they might be afraid to speak out about their mental illness for the reason of their mental illness being confused to their vocation?
I think you are right. Some are afraid to open up. To my own experience, some are afraid to open up, because you may open up, they say, no, this person is not fit in this congregation. I think it's not called here. That's why you see some people hiding themselves, or when they open up to someone to help them, you see the person starts exposing the person. So you see some people, I don't blame some people who keep it to themselves, and those who are bold to open up to someone, because you don't know who is who. You don't know who you can trust. That's why you see some people finding it difficult to open up to people. Yeah, that is my own point.
Thank you, sister. Thank you.
Even for myself, I think we need to be empowered by the knowledge that we learn about this mental health, and we know that, to really be convinced and to know that it's part of life. Because for me, I think even not even by words of being there for someone, but even to change for our own perspective about this issue. But for me, even to change our attitude and our even body language. For instance, how do we react when we hear that, oh, sister so and so is on antidepressant? What kind of body language? Maybe, I can even show the shock, because it could be a surprise, or could be something that we're not expecting or anticipating. But if we learn that it's mental health is an issue, and it's happened to any of us, and we don't know what caused it, but for sure it can even touch the society outside, then for sure it will touch our consecrated life. So even now I even learned to say, if I hear that, someone is on antidepressant, what kind of reaction or what kind of body language I show, because that also says a lot to the sisters or to the people around me. Thank you.
Thank you so much, sisters. Very good. Let's just continue. I just decided to include some of the records from the scripture where the psalmist is blessing. He said, blessed are those whose strength is in you, whose hearts are set on pilgrimage, as they pass through the desert valley, that would be mental health challenges. They make it a place of springs. The autumn rains also covers it with pools. They go from strength to strength. I have become, says, like a broken pottery, but I trust in you, Lord. I say, you are my God. My times are in your hands. Even though I walk through the darkest valley, that would be, let's just use the mental health terms, depression, I'll fear no evil, for you are with me, your rod and your staff, they comfort me. Now, the rest I will share with you this presentation. Now, my first question was, when we started with our presentation, what we understand by mental health, how can we help someone who is struggling with mental health, how can we deal with our own mental health, and so on and so forth. I think you all have shared your input on that. Well, to the last question, two questions, practically one question that you all raised, agreed about. I think one has to be open. We need to be honest to ourselves. And then, as Deacon Eddie Schooner, who is a permanent deacon in the USA, would say, we need to tell our stories. We need to be honest with ourselves, and we need to be open to those who are ready to help us in our growth, in our development, when it comes also to changing our attitudes. Not simply to say, I need to open up to anyone and tell my story, but I need to have someone who would challenge me. Normally, when we speak about a friend would be someone who agrees with me, with what, if I say, I want to go there, he would say, oh yes, let's go. No, I need a friend who would challenge me, sometimes would challenge the way I want to take, the direction I want to take in life. Not simply someone who said, oh yes, you are right. But I need someone to be there for me, to listen my story. And only once after that, then I can open myself to God and say, help me. This is who I am, and can help me to come out. And I go back to that aspect of being there, to listen and be there. you as a psychosomatic being, as someone who understands the situation, the challenge of other people, without judgment and without discrimination, and without just asking where I am, who I am, why, but be there as a caring, as a loving, and as a supporting presence. Let our presence be a meaningful presence and be also meaningful to ourselves. Unless your life is meaningful to yourself, you cannot make your life meaningful to others. Otherwise, we end up being dishonest. So that's what I would say. But before that, I just want to share with you this video clip, which I mentioned earlier on. I'm just going back to it, and bear with me. This is actually it's not the one. Just I think I missed it again. Missed it again. It's not. No. That's the one. Meanwhile, if there is any intervention, I would give a chance to anyone who is ready to share. While I'm busy, still just maneuvering this my computer. There anyone was any question or any intervention? Yes, sisters. Okay, let me just, you tell me if you. Did you hear that? Did you? Hello?
Yes. No.
Yes.
No.
Did you hear? No, you didn't.
No, click play and see.
No.
The sound.
It's not a volume. Do you have your volume up?
Yes, the volume. Oh, sorry.
Yeah, it's up.
Is it?
No.
No, there's no volume.
Yeah, I'll see what to do. Okay.
Lucy, you have a hand earlier?
Come before you, who have created us in your image. I was experiencing suicidal thoughts. You know, it would be better if I wasn't here. I'm really a burden on my family and I should just go away. Heavenly Father, we come before you, who have created us in your image and likeness.
I thought about dying. I just thought, what was the point? There's always something wrong with me. I can't be happy.
You have made us your sons and daughters. Thoughts were going through my mind like, why are you here? What's the point? We ask you, Lord, to strengthen us in our faith.
Nothing's wrong with you. You're being a little kid. You're being a baby. Get over it.
Continue to pour forth your healing spirit upon those who suffer from mental illness. I was diagnosed with clinical depression. I saw that as something that was bad about me. If I just prayed hard enough and if I just did the right moves in my life, then God would take it away from me. I think as Catholics, some of us can tend to over-spiritualize things and to underestimate the human and the natural.
When people might not fully understand the importance of mental health, they might say, yeah, well, maybe you just need to pray more, go to Mass more. If your faith were stronger, you wouldn't have these issues.
I'm a Christian, but I'm human. And if I can be physically ill, I can be mentally ill.
Too often when we're in a crisis, it feels like this is it.
And if something doesn't happen right now, it will never be better. It's hard to see a way that this could be different. Hang in there, get help, because it really can be different.
I look up at the cross and I see Jesus' broken body. I know that he knows my suffering. He can understand what I've been through. He can understand what I will go through, and he's there for me.
There is a really profound truth that suffering unites us or pulls us closer to Christ.
The connection between me and the rest of the body of Christ is real. Suffering united with the suffering of Christ actually has implications for the church.
Faith is about me and God in the context of community, to be known by each other, to support each other, to help each other.
In relationship, that is where profound healing takes place. We're never called by God to walk through this life alone.
When there is a hand that can guide you through God, it will be inspiring to know that there's someone there who may be able to help you.
You're not alone. That's the biggest thing I could say is you're not alone.
Thank you. That's what I just wanted to share with you.
12 years.
I am not sure if there is any question or anything that you would like to comment on that. Yes. Any comment or any sharing on that? What the video, the clip was on?
Yes, Sister Stephanie? Yeah.
No, I just wanted to say, you know, the one thing here that you said, sometimes we just don't know how to help the person. And it's important to recognize that that might be the case, and the person who needs help, I think, needs to know that perhaps we're feeling helpless, and that is difficult. Another difficulty is when the person, let's just say, has an addiction and doesn't seem to have any control over that addiction and affects community life consistently. It's you know, one has to be honest, yes, but to be able to recognize that sometimes it's difficult to help that person because that person, in a sense, may be resisting, maybe in a hole. So yeah, it's difficult.
You are right, sister. I fully agree with you, because it goes back to what I said also. If one is not honest with his or himself or herself, it's so difficult. It will become so difficult to help. Indeed. So one thing that we also need to understand also is that why is that person not ready to open up? What's the reason behind? Well, there could be many reasons. So it's also good to try to understand that, just to know where he or she is coming from. I know I was recently in one of the parishes somewhere where somebody said, no, you know what, so-and-so has to be removed from that parish because of what is happening in the parish, because of his or her actions. But then I challenged the person who said to me that. I asked him, why is he doing that? What he's doing as we speak. He said, no, I don't know, but but he's not ready to be helped. But let's go and just find out, listen to him. As I was saying repeatedly before, not only the body language, but also that non-verbal communication matters. And of course, at the end, sister, if one is not ready, if he or she does not want to be helped, we cannot. But we need to try our best to support you. Oh my God, it's our Lord sharing.
Sister Carolina, can unmute.
Thank you so much, dear sisters. Well, for me, I would like to just comment on the video that we have just seen. I got touched by the stories that the people were relating there. And the words that struck me the most was, if I can be physically sick, it also means that I can be mentally sick. Why? Because you see, sometimes when I'm faced with, let me say, depression or so, if I may say, you see, most of the time we blame God for everything. We blame God that if you are Almighty God, why am I suffering like this? Why do I go through all that I'm going through? But this video has made me realize that there is also a helping hand that is ready to always help. There is somebody there waiting for us or waiting for me to listen to me. But due to the fact that my mind is disturbed, I sometimes feel like I'm closed in that situation I'm faced with. I'm ignorant to the outside world that needs me to open up and to just be free to talk. So it has just brought something to me that I should not always think like it is only God who can help through God. He also can help me through other people. Thank you.
Thank you so much, sister. Thank you. Okay, thank you so much. I think it was Henry Nouwen. Some of you might have heard about him. He's a Catholic theologian who is also a priest, who said at one stage in the religious life, I'm trying to remember now, he said, in the religious life, we live together without knowing each other, and we die alone without crying for each other. So that shouldn't happen. Now, this should somehow help us to care for one another and also to listen to one another. Now, before I finish like my short presentation, there is just a video clip of 2 minutes. It's a prayer which was released by His Holiness Pope Francis, I think in 2021, while praying in Rome for those who are mentally challenged. So I just want you to listen to.
La sobrecarga.
Can you hear?
Yes.
Perfect.
De trabajo, el estrés laboral, hacen que muchas personas experimenten un agotamiento extremo, un agotamiento mental, emocional, afectivo y físico. De ahí la tristeza, la apatía, el cansancio espiritual terminan por dominar la vida de las personas que se ven desbordados por el ritmo de la vida actual. Procuremos estar cerca de los que están agotados, de los que están desesperados, sin esperanza. Muchas veces escuchando simplemente en silencio, porque no podemos ir a decirle a una persona, no, la vida no es así, escúchame, yo te doy la receta. No hay receta. Y además, no olvidemos que junto al imprescindible acompañamiento psicológico, útil y eficaz, las palabras de Jesús también les ayudan. Me viene a la mente y al corazón, venid a mí, todos los que estáis fatigados y sobrecargados, y yo os daré descanso. Recemos para que las personas que sufren de depresión o agotamiento extremo reciban apoyo de todos y reciban una luz que les abra a la vida.
So that's Sister Tao and the theme. That's where I want to end my presentation.
Is it possible if we can have some group sharing? Because it would be also nice for the group even to share in a small group and to have a chance even to see each other, because the human interaction also is a very good way to support each other. And so I'm not sure, Melissa is fine.
Yeah, sister, actually, what I was going to ask all to share in group was this. Okay, today we have somehow, we got some hint about the mental health care. So what now then from today? What is the way forward? What should we do in the very practical terms when we get back to our respective places, or let's say the convent where the sisters stay? And now my question is, how can we divide people in groups? That's the only question that will help you to be more closer.
We have 44 in this room. So if we divide 5 in each group, should it be enough for the group to have time even to share? We hope that each one will have a chance to also share and to participate and contribute. Is that fine for everyone? Eh? Okay.
Yes, thank you.
So I'll just assign what you call automatically. So if you get the invitation to join the group, then you just click and join. Okay. Let's say I will make 9 groups.
Okay, sister.
So just think of the way forward, or how do we take it from here? Thank you.
Sure.
So we'll have about 30 minutes in the group.
Sorry, dear sister, I got lost. I was in the group. Now I'm back to the main group.
Okay, is that Carolina? Okay, let me put you back to
Yes.
the group. Okay.
Even us, sister, can you please help us?
Okay, Andy, so okay, hold
Yes,
on.
thank you.
Even us, sister.
Okay. Yeah, you have to join. Okay, you just click to join.
Yeah, I'm still in there.
Anybody here? Anybody here?
Recording in progress.
In the group.
It's going. I wonder what are they doing?
Excuse me, sisters. Sister Ottilia, may you please mute? Thank you.
Okay. Sister Talon, where are you? Are you in Zimbabwe?
Yes, I'm in Zimbabwe, sister. How are you?
Okay, good. Okay.
Did you ever been in Zimbabwe, sister?
Yes, I was there last May.
Oh, that's great.
Yes, yes.
And where are you now?
I'm here in Midrand in Johannesburg.
Okay, nice.
How's the election? And who is Pelele Mtungwa? Is that Kumala?
Mabaso.
Mabaso. Okay.
Yes.
Okay. Which congregation are you, Pelele?
Newcastle Dominican.
Okay, Newcastle. Great.
We know her by Sifundo. Hello,
Oh,
Sifundo.
okay.
Sifundo.
Okay. So we just wait for people to come back to our big group because I think it's still a few more seconds. So a few more. Okay. Melissa, are you?
Yes, I'm there, Sister Tao.
So now I'm not sure if each group would like to share or would like from your.
I think, yeah, each group, the representative from each group could just say something about the discussions they've had, yeah.
And even some recommendation, you feel free to share with us because I think it's form of evaluation as well.
Perfect.
Okay, who's brave enough to be first?
Sister Talent.
Okay, go ahead, Sister Talent.
Thank you very much, sister. From my group, we've got a few points that we have discussed. The first thing that we have discussed about is about personal responsibility with my health. As an individual, I have to take care of my health, sort of to examine myself to see where, you see how you're operating as an individual. You talk, you see, and whatever. And it is also my responsibility to take care of other people's health, to see how people are behaving, how people are relating to others, to me as well. That was the first point. We also talked of openness. As I'm examining myself, as I'm taking care of myself, I need to open up so that maybe I will be able to see where exactly I need to grow, where exactly I need to maybe look wherever part of my health, part of others, and whatever. And also, we talked of confidentiality. Maybe I've discovered something, I've got a problem in this area. When I share, I need my space to be kept on by the person whom I'm sharing with. And also, that person should keep those things so that maybe I will be helped. Thank you very much.
Sister Tao, it's you.
Oh, okay. Thank you very much, Talent. Anyone else would like to share? Okay, Lucy, go ahead.
Thank you very much. And in our group, we discussed about dealing with the history of a person, like knowing the source. That is, knowing the source as to why this person is having like mental problem. And another point we discussed about being genuine and you trust the person you're sharing your problem with. And also we also discussed about the confidentiality and know what to say and what not to say when you are journeying with the person with mental health or like individually. You know the person you are confiding your problem in. Then also, as the way we also discussed about plan the conversation beforehand or in advance if you really know this person very well. Yeah. Yes, those are some points we discussed in our group. Thank you.
Thank you. Thanks so much. Okay. I'm not sure who is Samsung Galaxy, but please unmute yourself. Thank you.
Yes, so from our group, we've appreciated so much the input we got, which we found very formative and informative. And we've shared about accepting and being aware of what will be going on within, because sometimes we find that things will be just happening around us and we'll not be aware. And then some people around us are the ones to tell us what will be going on. Yet it will be very difficult to take that if it's coming from outside. And we also discussed that we need to be patient with ourselves. It's not a one-day thing, but we have to be patient and to be able to express ourselves, because sometimes we're not really able to express how we feel. Maybe we feel intimidated, maybe in communities, but we have seen it is of greater importance to express how you feel, especially when you know that no one really is judging you and people are there to support you, and be able to socialize freely and to share more about our lives and just to be ourselves. Those are the things that we shared from our group. Thank you.
Thank you very much. Okay, Naomi, please go ahead.
Okay, from our group, we discussed creating a conducive environment for people so that they can share freely, because if we look in our communities, if we have limitedness in terms of who to go to share our problems, then it becomes a problem. So we discussed that we should create that conducive environment for everyone, regardless of age, so that no one will feel limited to share. and also discussed to be aware of our reaction through our body languages, how we react to if we hear that sister so and so is suffering from mental illness, that should be revised. And then we also came up with way forwards to say we should give more chances and courses to different people, not only religious, because it's not only religious that are affected with this, but to be able to expose those things to other people who might need it. And in case a person who has come to you to share whatever is troubling her or him you cannot handle, you can always refer to those who know how to handle it better, like the professionals, so that the person will receive you or she needs. Thank you.
Okay. Thank you very much, Naomi. Anyone else? Just a question, also, Melissa.
Yes, sister.
She would just mention that if we refer somebody for professional help, from Casca, are there contacts for the department or for the projects that we can contact you when we need to have some information on those who are dealing with mental health issues?
Yes, sister. Yes, we do have a list of service providers like SADC, South African Depression and Anxiety Group, SFM, the South African Federation for Mental Health, and Hospivision also has got a section or personnel that deals also with psychosocial support or mental health issues. So we do have a list of.
Okay, all right. And another question, recently we have a youth gathering in Midrand, and there was a professor from University of Johannesburg, and he said from the higher education, there are psychologists to help students, college students, to cope with mental health issues. My question is, what about the primary and secondary level? You know, there is such service for the children who are in need of this support and help.
Yeah, in some of the Catholic schools, sister, I think we are so fortunate. Yeah, we do have some psychologists who visit the school, to help. But, in the government school, still that is a struggle. That's a struggle, actually. Yeah.
Okay.
Yeah.
Thank you. There is a question from Brother Kizito. Let me go back. Okay. Good day. Thank you for these comforting words. Mental illness is as real and serious as physically illness. I have been struggling for the past 2 years with my mental health. That is, since I took my first vows, I've have uncontrollable feelings of fear, anxiety, and severe panic when it comes to public reading and speaking. The thought of standing in front of people fills me with terror. This presentation helps me to acknowledge that this is not normal because I just turned 30 this year and I should have the confidence to do public speaking and reading. Can I please ask how I might find help for this problem?
Yeah, in this particular case, where perhaps we may need to have one-on-one session just to deal with his own situation. I think, look, he may need to just, this already, the first step is already taken by the very fact that he has already acknowledged that there is this challenge. I think that the next would be much easier now. However, he may need to have one-on-one session with someone who is in that field.
Thank you.
Okay.
And there's one recommendation that we should have this kind of workshop 3 times a year for the members of the temporary professed in the conference. And then also another other request that at least we should have one physical meeting, because we realize that also this kind of meeting, this kind of sharing is very helpful and profitable to all the members of our temporary professed. So in that case, we will take it up with the formation team again to see how we're gonna organize at least for next year, because for this year the next workshop will be on the 7th of October with Father Joseph Piri. So it's related to our journey as consecrated people. But we will send out the what you call invitation and also Zoom link for this coming workshop. I'm not sure if anyone else would like to share some thoughts in our groups, different groups.
Stephanie, I'd just like to say thank you. Thank you very much to the speaker, to those that's Melese. Thank you for your input. And I did ask Sister Tao if we could have your written notes as well. That might be very helpful. Thank you. And also to those who organized this. So Sister Tao, Sister Katie, Father Spelele, thank you very much. I think it was very helpful.
Yeah, thank you very much. So if nobody has more information or any sharing, we would like to ask one of the participants to just say a closing prayer for us. And again, yes.
Yeah, Sister
Oh,
Tao,
sorry. Yes. Okay.
Saint Difna is the patron saint of mental illness, so it would be good that we conclude these sessions with the prayer addressed to Saint Difna. Can we all see this?
Yes.
Yes.
Okay. All right. Can we pray together in the name of the Father, and of the Son, and of the Holy Spirit?
Amen.
I turn to you, dear Virgin and Martyr, together, confident of your power,
with God and of your goodness, my cause to your hands. I pray
Bless the Lord,
forgive
forgiving you
us,
to us as
spiritual
patronage,
endeavors and
nervous and
emotionally
emotional
distressed.
disturbed.
I
I
firmly
firmly
hope that
hope
through
that
this
through our
kind
kind
intercession,
intercession,
you will restore
you will
my
restore my lost serenity,
peace of
and
mind.
peace of mind. May it speak to my heart
to my heart and reassure me.
Amen.
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 Sorry, my connection went off. All right. Thank you.
Thanks everyone for joining us and for your time, your sharing, your contribution, which is very helpful and very, very enriching. So once again, we thank you for efforts and for all the presentation and all the tips and all the information that we need to learn about mental health.
Thank you.
Thank you.
Thanks so much, and may God bless each one, and may Saint definitely pray for each one of us to cope with our mental health and our mental well-being. God bless and enjoy the rest of your weekend. Thank you very, very
Thank you very much.
Thank you very much. Thank you.
Bye. God bless you
Thank
all.
you,
Bye.
Melissa.
Thank you.
Thank you. Thank you.
Bye.
Bye.
Bye. Take care and be healthy. Be holy.
Thank you. Thank you so much. Bye.
Bye bye. God bless.
Bye.
God
You
bless.
too. Bye.